I want to start today by highlighting several critical developments on both the testing and treatment that will help us win our war against the coronavirus. On Friday, the FDA authorized a new test developed by Abbott Labs that delivers lightning-fast results in as little as 5 minutes. That's a whole new ballgame. The deployment of rapid testing will vastly accelerate our ability to monitor, track, contain, and ultimately defeat the virus. We will defeat the virus. It will also allow us to test doctors, nurses, and other healthcare workers immediately and enable us to act quickly and aggressively to shut down the spread of the virus, so important in critical facilities like hospitals and nursing homes. And we will ensure that we can give cities and states the best information to guide local decision makers in making. I want to point out that the hydroxychloroquine is being administered to 1,100 patients, people in New York, along with the Z-Pak, which is azithromycin. And it's very early yet. It started 2 days ago. But we will see what happens. The FDA is also allowing the emergency use of a blood-related therapy called convalescent plasma as an experimental treatment for seriously ill patients. This treatment involves taking blood plasma from patients who have already recovered from the virus. So they're recovered, they're strong, something was good in them that worked. And so we take the plasma from those people that have recovered so well, meaning their plasma is rich in antibodies against the virus. We're also looking at an approval for the sterilization of masks. I kept saying to myself, I'd see some of the masks are very complex. We're delivering millions, by the way, millions. But I kept saying, why aren't they able to use that mask a second, third, fourth time? And Mike DeWine, the great governor of Ohio, called me. They have a company that is in the final process of getting approval for the sterilization of masks. And in some cases, depending on the mask, some of these masks are very, very strong, very powerful, very strong material. They're able to sterilize the mask up to 20 times. More than 90% of Americans say they are staying home as much as possible, putting their lives, their careers, their educations, and their dreams on hold out of devotion to their fellow citizens and to their country. Social distancing, that's the way you win. These shared sacrifices are pulling our nation together like never before. Family bonds are strengthening. Neighbors are looking after neighbors. It's incredible. You're seeing, everybody's seeing what's happening. Communities are rallying for the cause, and all divisions are fading away. The Americans of every background are uniting to help our nation in this hour of need. It's up to 151 countries. So when we say our nation and the world, when you think the modeling put together by Dr. Birx and Dr. Fauci and our other top healthcare and these people are amazing, the healthcare experts who in this country are the best in the world. They demonstrate that the mitigation measures we are putting in place may significantly reduce the number of new infections and ultimately the number of fatalities. I want the American people to know that your selfless, inspiring, and valiant efforts are saving countless lives. You are making the difference. The modeling estimates that the peak in death rate is likely to hit in 2 weeks. So, I'll say it again. The peak, the highest point of death rates, remember this, is likely to hit in 2 weeks. Nothing would be worse than declaring victory before the victory is won. That would be the greatest loss of all. Therefore, the next 2 weeks, and during this period, it's very important that everyone strongly follow the guidelines, have to follow the guidelines that our great Vice President holds up a lot. He's holding that up a lot. He believes in it so strongly. The better you do, the faster this whole nightmare will end. Therefore, we will be extending our guidelines to April 30th, to slow the spread. On Tuesday, we will be finalizing these plans and providing a summary of our findings, supporting data, and strategy to the American people.
We've reviewed 12 different models. And then we went back to the drawing board over the last week or two and worked from the ground up, utilizing actual reporting of cases. It's the way we built the HIV model, the TB model, the malaria model. And when we finished, the other group that was working in parallel, which we didn't know about, HIME, and Chris Murray, ended up at the same numbers. So if you go on his website, you can see the concern that we had with the growing number of potential fatalities.
So what I like to do as a scientist, a physician, a public health official, is to not ignore models, but say, look at the data as it's evolving and do everything you possibly can to mitigate that instead of getting overly anxious about the extremes of the model. Again, not to push them aside completely, but the reason the president made the announcement today about going to the end of April is because we want to make sure that we don't prematurely think we're doing so great. We may be, but we want to push it to the extreme. So take that with you, and maybe you'll be less anxious.
The question actually has to do with the $2.2 trillion relief bill that you signed into law. In your view, do you think that another relief bill, another phase bill, may be necessary? And are you prepared to support that, Mr. President?
Well, I'm prepared to do whatever is necessary to, number one, save lives, and number two, bring our economy back strong just like it was before. I think our economy has a chance to be just as good and even better than it was before. And remember, a lot of the money that you read about, that's all coming back. These are loans to great companies that got stopped from doing business. They'll be back very soon. So much of the money that we're talking about, that money's coming back, and we'll take warrants, meaning we'll take pieces of the company for the taxpayers of our nation. I expect that we'll make a lot of money with that money. We're going to make a lot of money, and that's okay. I don't even want to talk about making money, because what I want to talk about is two things. Number one is saving lives, and number two is bringing our economy back.
There are a number of communities, cities, states, what have you out there, in which they're trickling along like that. Don't get complacent about that, because that's exactly the way the virus works. It goes like this, then like this, and then it goes up like that. That's exactly what happened in New Orleans. That's what happened in a terrible way with New York. That's what we're trying to avoid in multiple locations throughout the country. So we shouldn't take any solace when we see low levels in different states, different cities, different areas, because they're very vulnerable to an explosion.
We're all in this together, all of us. I have never seen anything like it. The unity, the esprit de corps, the spirit, I've never seen anything like it.